Dr. Clayton Roach here, and today I want to talk to you about the two most common and most popular chiropractic techniques in the world. So one that we do in our office is what we call diversified. And diversified is kind of like a mishmash of a lot of techniques, but those are the ones where we actually use our hands. It's basically considered manual therapy. So basically, those are the ones where you get all the positions where we lie you on your side and we actually give an adjustment where we're pushing in the joint that's out of alignment, pushing it in a direction that it's not moving into. Now, of course, when we do that, we're going to hear the little clicking noise, and that clicking noise, which you should know by now, is nothing to be afraid of. It's just gas that's being released from the joints, and it sounds actually louder in the neck because we're close to the ears. So that's what we call diversified. So anywhere we're going to be finding a joint that's not moving well, our whole goal as a chiropractor is to move that joint in the direction it's not going into. And the reason we want to do that is because if you don't use it, you lose it, and that's what we get to call arthritis down the road. The other technique that we use is basically called Thompson technique. And Thompson was the last name of a guy, a chiropractor. His name was J. Clay Thompson. And he invented the drop piece. So if you've noticed in our clinic, oftentimes you'll be waiting, you'll hear the bang and the bang and the bang, and some people come in, it's their first visit, they're thinking we're beating our patients up. But it isn't that, it's the table. And here's what happens with the tables, and I get that question often: what does it do when the table drops? Well, here's what it does. When we push on your pelvis or your middle back and the table drops, obviously that table drops quick. And that quickness is what allows us to move that joint without the muscles engaging and tightening up. Because some of you have probably noticed when you come into the chiropractor, we put our hands on you, it's very easy to tighten up because you think it's going to hurt and you anticipate the push. Well, what this table does when it drops quicker than you can react. Within a millisecond, the table drops. And if we're pushing on joints that have muscles that anchor there, but their muscles are not engaging and they're not tensing up, it makes it far easier to push that vertebrae in alignment utilizing the drop. Now, there are certain people where we're more likely to use the drop, and there are more people where we're more likely to use the diversified technique. Now, here's the last, and I would say, a far third, is what we call handheld device technique. So we use the activator. That's the clicker. What it does, it uses a little percussion and it pushes that little rubber knob onto the spine to get the vertebrae to move. We love to use that on kids, and we love to use it on more elderly people where there's a risk of fractures because of a condition called osteoporosis. So here you have it: diversified, Thompson, and the handheld device that we use in our practice called the activator. So three methods which allows us to basically tailor our adjustments to whoever's in front of us. Obviously, we want to treat kids different than we treat elderlies, that we treat athletes, that we treat just a normal Joe or Jane, 40 years old, that works. So everybody needs to be different, and that is sometimes what medical doctors don't realize, and they may say, no to a patient that asks them, should I go to a chiropractor? If they have osteoporosis, they're going to say no because they don't realize that we have different techniques for different folks. So different strokes for different folks. For us as chiropractors, those techniques are key, so that way we can serve a greater number of people. I hope you found that informative. I know there's people in your circle of friends that need this information, that they might be on the fringe of needing a chiropractor and they're not sure what to do, and we just don't want them to continue to do the same things they've done over and over again without getting any results. And that's what people do when they don't have something new to try that they feel comfortable trying. So be that, hound dog that goes out and tells people about chiropractic, and you feel like telling them about us, then we would definitely appreciate that as well. Thank you so much. Have a great day.